leadership and formation to make sure all stakeholders know how they work closely with each other and how each other's interventions complement each other. We are strengthening, responsible for advocacy to ensure adequate communication and community engagement for prevention and control, to enhance mobilization, utilization, and accountability for resources, to strengthen planning, monitoring, and evaluation, and ensuring there is sufficient data to answer all the questions our leaders may have and to guide an effective HIV response. To strengthen HIV and AIDS research, so some of the questions that need to be answered in moving forward. So we strengthen research, we conduct research, we work with research institutions, we have a research agenda, and we lobby research institutions to prioritize some of the research questions that are in our research agenda that will contribute to us fighting every day the epidemic. We strengthen policy, legal, institutional capacity, strategic guidance, and regulatory frameworks in coordination of the national sector response. Currently, we are working on overhauling the overarching national policy, considering the significant changes that have taken place. The current policy was first developed in 2011, so it has been overtaken by events, and considering the changes that are happening right now and the transition, so we are overhauling the policy to reflect the current realities. But also keen in strengthening mainstreaming of HIV control and prevention in all sectors. Like we said, it's a multi-sectoral response. Every sector has a role to play. The next slide presents where we stand, a snapshot of the status of the epidemic. The number of people living with HIV keeps growing, and that's because people are on treatment, so they live longer, and people are still contracting HIV. I will see down there 34,000 contracted HIV in 2025. So there is an addition all the time. But you will see that the epidemic still affects women more disproportionately compared to men. The column for women in the first row has young women, including children women, and the men and young men, which includes the males. So the 71,000 is still part of the 980,000 and 569. So women, it's 980,000 as compared to men who are 569. The HIV prevalence average for all adults in the country above 15 years is 4.7%. We're in a better place than we were last year. It is higher in women, 6.3. So for every 100 adult women, 6 are HIV positive. For every 100 adult men, above 15, 3 are HIV positive. New HIV infections have come down. We are 34,000. We are 37,000 last year, and we are 38,000 the previous year. But you can see women are still disproportionately affected, close to 20,000 women and 10,000 men, and 4,400 children. New HIV infections, particularly among young women, this is important. Women between the 15 and 24, they are responsible for why there are even so many more women than men contracting HIV, that age bracket. So we see among young people between the age of 15 and 24, who are 12,700, 10,000 are girls, are young women, and the young men are only 2,700, almost 4 times. And this discrepancy explains why there are much more women, because during that age bracket, more women contract HIV it can never be evened out. AIDS-related death, we still register death, unfortunately. We registered 19,000 deaths last year, 2025, but the previous year we were only at 20,000. So we managed to reduce by only 1,000. Of those, 8,000 are women. You can see there are more men dying, even though the proportion of people living with HIV are much more women. But you see more men are dying compared to men, and 2,900 is equally a high number. 2,900 for children out of 71,000. So the proportion of children dying of AIDS are also disproportionately high. We are going to introduce
too high, and nobody can bother to go for test for medication. Actually, my parents need to have a clear put and a real number that is there, because I die hanging themselves if someone knows that is HIV/AIDS can not take a drug. Now another one has just taken a drug for pigs because he's tired of taking these other drugs that they, it's better to find out in Kibale. Now those strategies we need to know. How do you want us to go parallel to go?
Ate tubeebaza. But you see, obudde butuuse ne bapulling out support. And dembe lyabwe okubanga nabo balina priorities ewaabwe. But ensinga Uganda wetuuse tetusobola kulindirira batuddukirire. No. Eggwanga lyaffe likuze naddala mu bintu bya tekinologiya ate ne ssente weeziri ezirabira abantu naddala mu kano akaseera kano akakazigizigi nti nga bwe mulabye bapresenting abakulu mu Uganda Aids Commission nti abaana abali wakati w'emyaka 14 ku 24 ate bo kigenze wala kawuka ka siriimu. Ekyo kyabulabe nnyo kubaabo population yaffe esinga mwabo akakiiko ka commission nga bwe kamwebaziza okuchampioninga. Mama Janet Kataha Museveni abeere ekyokulabirako mu Africa nti Africans we can have solutions, first of all science-led solutions, but also taking the initiative to mobilize our masses, but also to sensitize them on the awareness.
And I did public health, when it comes to that. So HIV is, I would say it's my area that I understand much. But of course, when it comes to parliament issues, I've yet to learn much, but slowly I will learn. And the thing I said that previously it was already a strong one that was heading, and it was the deputy. And what I think after 2 years and a half, I will be the chair and one of you will be my deputy. You can continue.
First of all, I want to appreciate the Aids Commission for the good work they are doing. Personally, it's today that I've learned that UAC does more of oversight, planning, coordination, actually above site role on the treatment and care, as I thought before. And now, as members of parliament, our role is basically oversight role, and then also, of course, policy design and implementation, and enacting policies. I would want to hear from UAC. There's usually 1% budget that's allocated to MDS, especially construction companies. I've always seen people do contracts have a budget of 1% funding given to them. And I don't know what monitoring mechanisms we have in place as UAC. Road constructions, whatever, the 1%, how is this money being monitored as really what doing the intended role? The other one is that I also wanted to understand the nexus between men being the highest, being those who are the men transmitting HIV than women. Again, men die faster than women. And the other is that women are more infected than men. The nexus between men transmitting more, then men die more, and then more women infected. Then the other I wanted to really understand is that the 95,